Hi folks, Ron Ray here with Turning 65 Solutions. What I'd like to do today is just take you through a quick little tutorial of how to use the Medicare.gov website to search for your prescription drug plan, Medicare Part D plan. So what you'll want to do is just navigate to Medicare.gov. This is the government website. It's a public website. You can do this yourself. And then go find this button right here. It's called Find Drug and Health Plans. Click on that. When it comes up, you'll start your search. There's two ways to do it. There's general search, and then you can also do a personalized search. I always just do the general search. That way you don't have to give the government too much of your personal information just to get started. And you get the same data back from the website as you would with a personalized search. So just start with your zip code. We'll use ours here. You can close the survey form. We'll select the county where we live. And then most people are going to fall under this category here. You get your Medicare coverage from Original Medicare. And most people are not going to get any extra help. And just for the purposes of this video, that's the way we're going to pick them. And then what we're going to do is enter your prescriptions. Now, if you don't take any drugs, then you'll want to click this button here, I don't take any drugs, and then skip drug entry. And what it'll do is it'll show you all of the plans in your area based on the lowest monthly plan premium. But for our purposes here, we're going to assume that we take some drugs. I wouldn't bother with this button here because there's no purpose to it. If you don't want to add your drugs, then there's no sense wasting your time in doing this search. But for most people, they're going to be taking some sort of maybe a blood pressure medicine like lisinopril. All you need is the first couple of letters of the word, and it'll give you some choices here. And then you'll put in the milligrams that you take and the number of pills that you get filled at one time. So if it's one pill a day, then you're going to get 30 of them every 1 month at a retail pharmacy. Now, if you get your prescription filled every 90 days through the mail, then all you'll do is you'll select 90 every 3 months at a mail order pharmacy. I like to do it the other way just so we know what we're going to run up against if we walk into the local Walgreens or CVS or grocery store pharmacy. And then you can add another one. Let's say you take the generic version of Lipitor, which would be atorvastatin. $30 of them a month, every 1 month at a retail pharmacy. And then let's throw one in there that's a brand name drug. These are both generics. Let's throw a brand name in there. And let's say that you take one of the drugs that you see on TV for maybe type 2 diabetes, like Januvia. And if that's all you take, then you just go down here, click My Drug List is Complete. Now, before I do that, I want to show you one thing. Your information that you've entered so far has been saved under this anonymous ID number. And you can come back to this search at any time using the information here, the drug list ID and the password date and your zip code, and all of your information is saved. But it's important to know that it's saved anonymously. It's not attached to your name in any way. And it's going to show you a few of the pharmacies that are close to the zip code that you picked. So I usually pick the local grocery store pharmacy and then maybe one of the chain corner store pharmacies like Walgreens or CVS. And it only lets you pick 2. And then we're going to select prescription drug plans with Original Medicare. The other two options down here are for Medicare Advantage plans. We don't want to look at those right now. We just want to look at standalone prescription drug plans, Medicare Part D. Now what's happened is this search has resulted in a sorting of the 23 plans that are available in our area. And so it's going to sort them based on the lowest remainder of the year retail cost. That's your total out-of-pocket cost for the rest of the year. That includes your monthly premiums for the plan, any deductibles that may be required, plus your copays when you go to the pharmacy. It adds all of this up and it tells us what's your actual bottom line out of your pocket for the rest of the year. And then normally we just pick the cheapest one. In this case, it happens to be Silver Script. So if we look at the details on the Silver Script plan, it costs $27.50 a month is the premium. It has 0 deductible. And here's your copays. So at the HEB pharmacy, which is our local grocery store, the atorvastatin is going to cost $3 for a 1-month supply. The Januvia is going to be $47, and the lisinopril is going to be $1.41. And you can see if we select the Walgreens tab, between HEB and Walgreens, they cost exactly the same. Now the chart down here shows you what's your total monthly cost through the rest of the year that includes your premiums plus your copays. So for these drugs with this plan, you're going to be paying a total of $79 a month, premiums and copays. And then here's a recap of the prescriptions that we entered. If you need to make any changes or add or delete any drugs, you can do that here without having to go backwards in the application. Now what I usually do for my clients is I'll print this page out. You just right click on it, select print, and it prints the page. And what that does is it gives you a hard copy to keep, but it also keeps you a record of this drug ID. So next year during annual enrollment season, when it's time to reevaluate your drug plan, you don't have to go through the whole process of re-entering your drugs. You just enter the drug list ID and the date as your password, and it brings it all back up. You just make any adjustments that have been made to your prescriptions throughout the next year. Now, if we return to the previous page, you can see all of the plans that are available listed from least expensive to most expensive, and you can see there is a great difference between these plans. This is just the top 10. But that's almost a $400 a year difference between these plans. Remember, you're getting exactly the same service. So in my mind, there's no reason to pay more for the same service. Now, when you decided on a plan, you can enroll right here through the website. Just click this button, enroll, and it will enroll you in that plan that you've selected. Now, that's one of the things that we do here for you. Remember, we don't get paid by any of these companies. We just point you the right direction and help you get enrolled. Now, I'm not going to go through a fake enrollment here on the system, but I just brought this up so that you can see that you enroll right here on the system through Medicare. They send the information to the insurance company and get you enrolled for your starting date. That's what we do for you, folks. If you have any questions, please give us a call. The number is 800-515-4031, or you can look us up on the web at www.t65s.com. Again, my name is Ron, and thanks for taking some time to spend with us. If you have any questions, give us a call. Thanks.